Hey there, Dr. Roland Caire here with another episode of ToothsDay Truths, where I answer your questions on dental care based on over 40 years of experience. If you're enjoying these videos, please take a moment to subscribe. Today's episode has no guest because I wanted to talk about a more serious subject, something that dentists are always on the lookout for, and that is
Cancer?
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 Yes, cancer, and specifically oral cancer. I'll start with some general facts. Roughly 54,000 people in America alone will be diagnosed with oral cancer in a typical year. Of the 54,000 people diagnosed with oral cancer in a year, only 57% will still be alive in 5 years. Oral cancer will kill 9,750 people in a year, or roughly one person for each hour of the day, 24 hours a day, for 365 days a year. Men are 2 to 3 more times likely to get oral cancer, and it occurs twice as often in the black population compared to the white population. So, what are the risk factors for oral cancer? Age. Oral cancer more frequently occurs after the age of 40. Tobacco use, and that includes using smoking as well as smokeless or chewing tobacco. If you add alcohol use to tobacco use, the risk of oral cancer is 15 times greater. And in the last few years, it's been shown that human papillomavirus, or HPV infections, a common sexually transmitted virus, is also a risk factor in oral cancer. So what are the symptoms of oral cancer? Well, that's the scary part. It's usually not painful until its last stages. It commonly starts as a small red or white patch on the soft tissues of the mouth, or it could manifest itself as a small lump or swelling. But since few people ever look in their mouths, it usually isn't found until a dentist does an examination, which is why dental checkups are important. It could actually save your life. What will your dentist do if they see something that looks like it could be cancer? Well, that depends. There are some things that need attention immediately, and in those cases, you'll either get immediate treatment or be referred to a specialist. But in many cases, they'll start by making you aware of what they see, and then they'll ask you questions about your lifestyle. That's because there are a lot of common injuries that can look like oral cancer. You may have a habit of chewing on your cheeks, or you may have eaten some pizza out of the microwave that was way too hot, or you may have had too many margaritas at your local taqueria and scratched up the inside of your mouth while you were scarfing down those free tortilla chips. Then, if the area in question can't be related to a specific injury, they'll usually ask you to watch it for 14 days. That's because in 14 days, almost every injury to the mouth will heal. If after 14 days the area still looks suspicious, the dentist will advise you on what to do next. So what I want you to know is, oral cancer can be dangerous, scary, and deadly. But if it's detected early enough, it can be easily eliminated. The key to a good result is regular dental checkups, so your dentist can keep an eye on any issues. In other words, what I'm saying is, see your dentist regularly. For more online information on oral cancer, you can visit the American Cancer Society at www.cancer.org or the MD Anderson Cancer Center at mdanderson.org. Other locations specifically concerned with oral cancer include the National Institute of Dental and Craniofacial Research website at www.nidcr.nih.gov and the Oral Cancer Foundation, found at www.oralcancerfoundation.org. Remember, the information I provide is only to be used as a guide and is no substitute for a visit to your dentist. If you have any other questions you'd like me to answer, please post them in the comments. Or you can find me at rcaredds, that's RCAIREDDS, at Facebook, Instagram, TikTok, and Twitter. Or you can email me at rcaredds@gmail.com. And please remember to like, follow, share, and subscribe. It really makes a difference. See you next Tuesday.